What are the limitations of telehealth modalities? Imagine trying to get a full checkup through a screen. While telehealth has made healthcare more accessible, it also has some clear limits that can affect how well it works. Let's explore what those are. First, telehealth cannot replace hands-on physical exams. Doctors often need to feel, listen, or see specific parts of your body to diagnose certain conditions. For example, checking your heartbeat with a stethoscope or looking at X-ray images cannot be done remotely. This means some illnesses or injuries still requiring in-person visits. Next, technical issues can get in the way. Telehealth relies on good internet and working devices. If your connection drops or your camera or microphone don't work properly, it can interrupt your appointment. Not everyone has access to high-speed internet or the latest gadgets, which can make virtual visits harder for some people. Data security is another concern. When health information is sent electronically, there's always a risk of hacking or unauthorized access. Healthcare providers must use secure platforms and follow strict privacy rules, but breaches can still happen. This makes protecting your personal health data a challenge in telehealth. Insurance coverage can also be a limitation. During the COVID-19 pandemic, many insurers expanded telehealth coverage. But now, some services may not be fully covered or reimbursed. Patients might have to pay out of pocket, and providers may face uncertainty about getting paid. Policies can change, especially for services outside approved locations or for certain types of visits. Legal and regulatory rules add another layer of complexity. Different states and countries have their own laws about telehealth. Providers need to be licensed in the patient's location and follow specific standards. These rules can make it difficult to offer telehealth across borders or in certain regions. Building new patient relationships can be tricky too. For new patients, some telehealth services like audio-only calls might not meet requirements for establishing care. This can delay access for people trying to see a doctor for the first time. Continuity and quality of care might suffer. Some critics say virtual visits can feel less personal, and doctors may lack complete information without a physical exam or full medical history. Telehealth is best used to supplement in-person care, not replace it entirely. Remote patient monitoring is helpful for tracking health at home, but it depends on patients having the right devices and knowing how to use them. Inaccurate data or delays in sharing information can affect treatment decisions. Mental health teletherapy expands access, but it's not suitable for everyone. Patients needing urgent or intensive support may require in-person help. Privacy at home can also be an issue if someone else is nearby during a session. Finally, setting up telehealth appointments can be a barrier. Patients need to know how to use digital platforms, schedule correctly, and have the necessary devices. Those unfamiliar with technology or lacking resources might find it hard to participate. All these factors show that while telehealth offers many benefits, it also has limitations. It works best when used alongside traditional in-person visits, especially for complex or urgent health needs. Understanding these boundaries helps both patients and providers make better choices about when and how to use telehealth services.